Hi there. How's it going, Doreen?
Hi, I'm Doreen Marshall. I'm the Vice President of Mission Engagement for the American Foundation for Suicide Prevention. And I'm here with Jackie from NowThis. We're going to have an interesting conversation today, focused on a little bit more of a serious topic around addiction and substance use. Hi, Jackie.
Well, it's great to be connected with you again. I know we've been doing these really fantastic weekly conversations with NowThis and AFSP, and today, I think this is a topic we've touched on briefly, but I think it's so important that we are taking the time to dive into every aspect of this, between addiction and substance abuse, whether that be with drugs and alcohol or even food and other things that might drastically change our habits. So you're right. I think this is a serious conversation, but one that a lot of people need to hear or want to be a part of. So I think first we should just touch on having the conversation around addiction and why that makes it difficult in the first place. And I think that word is shame. So where would you want to start with how shame just first of all negates these conversations and really doesn't foster anything healthy to start combating this?
Well, I think what a lot of people miss is that addictions are physical conditions, just like mental health disorders are, that this is not a character flaw or something that's wrong with the person's habits. It's more that what we know about, particularly alcohol use, is that um, it changes people's brains react differently to alcohol if they have kind of a genetic factor that makes them more predisposed to addiction. So, what I always say is when people are not addicted, it's very easy to look at somebody who has an addiction and say, well, why don't they just stop what they're doing? But it's much more complicated for people who have addictions. And I think because of that, people often feel shame. Like they feel, well, if other people can control their drinking, eating, whatever the addiction is, why can't I? And what we know is that it is biologically based just as much as it's based in environment and other things, similar to the way mental health conditions are.
And so I think the first tier of this is addressing people who have been struggling with an addiction uh, before the coronavirus outbreak. What have you been seeing with how people are still trying to cope and recover, uh, or limit, or maybe they've bounced back? I'm not sure what you've seen as the trend, but I imagine there's a lot of struggles that come with this when you're suddenly in lockdown and your resources have changed quite drastically to being virtual.
Yeah, well, it's a great question, Jackie. And a lot of the people that I know that are in recovery are working an active recovery program, meaning they're going to 12-step meetings, or they may be meeting regularly with a mental health provider or sponsor. They have a community of support around their addiction. And I think what's been challenging is that as we've been in lockdown and just our ability to have that contact has changed. I think that's changed the way folks have set up their recovery. What's important though is that we use all of these other things, virtual and other ways to stay in contact. The folks that I know that would normally, meet up with their sponsors in person, for example, are having to do it other ways, just like we are. But I think that's been a challenge for folks. I think the stress of it too. This is the first time that many of my friends that are in recovery are dealing with a stressor at this level, right? As most of us are. And when we think about the way we all cope. For someone who's had an addiction, their addiction may have been a way they coped with big stressors or with things that impacted their mental health. So I think that's different now. But the resources are still out there, and I think that's really what what we need to continue to encourage folks that, like we've had in other conversations, things have changed, but those resources are still accessible to you, and it's important that you still engage them.
I think a frustrating factor, though, is that some of these programs are no longer in person. You lose that in-person connection with your group or with your sponsor just because of the regulations that we're supposed to follow. And some might feel that having it on a virtual platform isn't as effective or doesn't give that same satisfying feeling to have progress. So do you find that these resources still can be just as effective, or are there certain things they can do to still get that validity from it?
Yeah, well, I think that's a really great question. And I think one of the things that you and I talked about privately is this idea of people may be connecting with these resources in their homes where other people are. And so, being able to do it privately and being able to really engage those resources and be vulnerable, it may be a little more challenging if you're home with other people that, and creating that space and that privacy for you to engage that without worrying about who else might be with you. I can imagine that can be a challenge for folks. And I think, like a lot of things right now, the shame that people feel just about their own vulnerability, like I should be able to go this on my own, or I should be able to do things the way I've always done them, and recognizing that what's happening for this kind of national stressor we have is really challenging all of us in new ways. And particularly if you're someone who's struggled with addiction or recently in recovery, it can be really challenging you right now. But that doesn't mean you won't get through it, that you won't find new ways of coping. And it may mean adapting or modifying the way we currently do things.
This conversation just has so many different tangents and subtopics within it, and I'm trying to make sure we hit each important audience within this accordingly. And I think the next obvious jump is somebody who never thought that they'd become addicted to something and maybe mindlessly are forming new habits being in lockdown, and maybe that means having a couple glasses of wine a night, or resorting to something to help them sleep because they're waking up in their office and going to sleep at their office, and these kind of repeating factors. So how do we help somebody evaluate their daily routines and see if they could possibly be forming their own addictive habits without even knowing it?
So important. And I think that might be something that those that are tuning into this are wondering about, either for themselves or someone they love. So how do you know when, your current patterns of use are starting to become problematic? And, just like when we think about things that indicate that our mental health is struggling, we look for changes in behavior and trying to understand them. So, for example, someone who would have a periodic glass of wine might find that then they're starting to have 2 glasses of wine, or drinking every night, or, like you said, drinking to fall asleep, drinking to unplug from the day. And if you're noticing a change in your use patterns, it's important to kind of take a step back and say, okay, like, what is that about? And I think what most of us may be realizing is that that's an early indicator for us that we're drinking beyond the enjoyment of having a drink itself, that it's becoming part of our ritual to relax, for example. Or if you think about that with any substance, right, that when we're using it beyond its function, that might be something for us to think about. So food addiction is something I think a lot about these days, particularly because I think many folks that struggle with disordered eating are having some challenges right now as well. And, one of the things I've learned is that food is for function, right? That we should be eating to fuel our bodies. And so that if we start to notice that we're engaging in ways that are different for different reasons, to bring comfort, for example, and this is with any type of addiction, or to numb out our feelings, that may be an indicator, that change may be an indicator that something else is going on for us. And so I usually tell folks, like anything, you're weighing the pros and cons, right? And if it's disturbing you, or if you're wondering about it, chances are it's changing in a way that's raising some concerns for you. Most of us, I think, go throughout our day, if we don't have any patterns or proclivity toward addiction, we go throughout our day and really don't think twice about when we're going to have our next drink, or when we might have, it's not something that interferes with our day to day. But I think when people are struggling with addiction, their lives sometimes kind of start to center around the addiction. So they look forward to it in a way that maybe changes the way they react to other things in their life. So one thing I might think of, if I were home with a spouse or partner right now, and my spouse or partner wants to watch a movie, and what I really want to do is drink and veg out separately from that. Or if I might be organizing my time around how to access alcohol, those kinds of things might raise a concern for me, like if it's getting in the way of my day-to-day things I would normally do, because now I'm focused on enjoying my time with a substance. I hope that's clear. We're really looking for changes in what would be normal for us.
Have you noticed a shift in attitudes towards, specifically, I guess, alcohol might be a common one to say, come join this work happy hour, or let's do this social distancing happy hour, get liquor to go. Have you seen an attitude change with that being kind of the natural thing to bring virtual bonding or social distancing bonding together? And are we teetering a place where that could be a dangerous thing to just assume that's the thing we should lean on, and that's the just go-to event we should host?
You're hitting on something really important, Jackie. And one of the things I've been mindful of in my own language in my life is that when I invite people to a happy hour, I actually don't use the term happy hour. I usually say coffee hour or something else, because I'm mindful that even in my own network, I may not be fully aware of everyone who's dealing with a battle with an addiction, or recently in recovery, or working. I mean, people aren't always open about their working a recovery process. And what I worry about is that as we promote happy hours in the traditional way, though virtually, that we might be inadvertently excluding folks who need connection and support, but really aren't going to feel comfortable at a Zoom meeting where other folks are tipping their glasses. Or so I'm really mindful of even just our language in terms of how we connect with one another. The other thing I've been really mindful of, and I know you and I have talked about this, that even social media in a way has kind of, in this time of COVID-19, is kind of normalized or put out there that more people are drinking. And so you see kind of different memes and things that almost in a way kind of put out there that people are drinking because they're working from home, or that they're, starting happy hour because it's 5 o'clock somewhere. This idea of putting that out there for someone who's struggling or who's having trouble kind of maintaining their recovery. These things can actually feel like it's challenging them, or feeling like it's further creating this sense of shame about that they're not taking part. Does that make sense?
How do you block that out? How do you filter that out?
Yeah.
So you're thinking about wine, and all you're seeing on your feed is everyone else, cheersing.
Right. And so, I think as much as we can be mindful of that and be inclusive, even in our invites to others, like, and the language we use, mindful that there are many people who may be struggling with addiction right now. And it's not just alcohol, but alcohol is certainly one of the ones we're concerned about.
So how do we go about recognizing these behaviors? If it's not me and I'm noticing something off with a friend, is it a trust your gut kind of situation? It's tough to do that if you're not in person all the time.
Yeah, and I think sometimes people may even joke about their use as a way of kind of like just putting it out there, or kind of testing the waters about, like, is this change in my use something I should be concerned about? So I've seen people put out on social media or even in conversation kind of yeah, well, I'm ready for happy hour at noon or something like that, and putting things out there as a way of kind of checking or testing the waters to see if people are reacting. Again, I'm not saying that they're doing it to get attention. It's more that they're kind of seeing, is this trying to gauge, is this an okay behavior, or is this something that other people are doing? And I think, the biggest thing for people to think about is, if you're worried about someone's use, chances are there's something to worry about. And it's important. This is another area to have a real convo in, and just say, hey, how are you coping these days? And are you finding you're turning more to drinking? Or if it's somebody who's in recovery, asking them specifically, how is all of this impacting your recovery? How are you doing? What are you needing that you're not finding in our current circumstances? And really just being transparent about it. You might even be some disclosing, in that you might say, hey, I've noticed lots of people are putting information out on social media about drinking these days, and knowing that you're in recovery or that you've been struggling, I'm wondering how all that is impacting you. And really just kind of getting to the heart of the matter. And then, of course, like we want to with all of our real combos, then helping connect the person to some help, particularly if they're alone and struggling right now.
And I also think it's important to, remind people that the stress they're feeling is valid. I heard somebody tell me when this started that, working from home is stressful. But we're not just working from home, we're working from home during a pandemic. So you're not just dealing with an addiction or recovering from an addiction from home, you're recovering or dealing with an addiction during a global pandemic. And that, I think, has some valid stress aspects of it that are completely understandable and completely okay to talk about. And I think we're forgetting that. Like, we were just starting to see the headlines, and it's becoming something that's our new normal. But it is an additional amount of stress that can lead to serious issues down the line if we don't, realize that we're a part of something much bigger than just being isolated in our four walls at home.
It's so true, Jackie. And I think a very big piece of this that we all need to remember is that we're all coping with new stressors. And part of the recovery process, and really what fuels addiction, is that people use substances often to cope, and that part of the recovery process is developing new coping strategies. So if you think about it right now, we're all faced with a new stressor. And many of us are relying on existing coping strategies to get through this. But if your existing coping strategy is one that's brought challenges for you, like an addiction, you may be kind of feeling this tug of war, in that it's what you use to cope, and there's new stressors, but at the same time, it's a way of coping that's created some problems. So, what I try and remind people is, just like right now, we're all learning new ways to adapt. That is also part of the recovery process, is learning new coping strategies. And so I only put that out there because I think there could be people listening who are frustrated with family members or others who may be struggling a little bit more right now. And to remind them that recovery is a process, but it's also important that it's an active process of learning new coping. And that's where mental health treatment, 12-step meetings, all those things that exist to support recovery are really important for people to engage in right now if they're struggling.
I know we have to wrap up soon, but I think the last thing I wanted to touch on with you that might be obvious, but maybe just kind of reiterating it, is the blunt message some people might need to highlight the seriousness of addiction and substance abuse at home. Is, you're representing a suicide prevention organization. Why are these conversations now about addiction and mental health part of that prevention process? Why do you think it's important that, we're talking about these issues, even though we're not necessarily talking about suicide today? This is a factor, a stress factor that, would you say, is part of that prevention process?
Well, what we know about alcohol in particular, but I think it does pertain to other substances, but alcohol is a central nervous system depressant. So what happens is if you're depressed and you're drinking, over time, people who are depressed tend to feel more depressed. And one of the things with suicide prevention we know is that substances do play a part in terms of suicide risk. So if you have someone who's already depressed, for example, and okay,
I'm sorry.
I think I'm back.
Yeah, you went out for a moment. You were talking about the correlation between somebody dealing with substance abuse with alcohol and how we address that also with suicide prevention. You got cut off right there.
Right. So what I was saying is that it increases the use of substances when you have a mental health concern, actually increases your suicide risk pretty substantially. So we want to address both, right? We want to address someone who's struggling with substance use, but also who might be using that substance to treat depression or anxiety or relieve stress. Because what we know is that these things intersect. And it's an important suicide prevention message because we want to make sure that, particularly right now, that people are taking care of their mental health. But part of taking care of your mental health is also making sure that you're not using substances that may have an impact on your mental health for the worse. Like I mentioned, with alcohol being a central nervous system depressant, it tends to make people feel more depressed over time. Again, substance use is something we look for in suicide risk. And so we want to make sure, particularly if you're worried about someone and their mental health right now, that you're also thinking about, are they using substances to cope?
Well, this has been a lot to unpack in just 22 minutes, but I certainly appreciate you being candid with me and talking about these important subjects that I know a lot of people are dealing with at home. And I know we could go on, you and I could talk for hours, but again, thank you for joining us today. I really appreciate it.
Thank you, Jackie. It's an important topic. Glad we covered it.
Yeah, we've been putting up resources on our screen throughout this live stream, but of course, if you need additional support, you can call the National Suicide Prevention Lifeline at 800-273-8255, or you can contact the crisis text line by texting TALK to 741-741.